The global antidepressant market is worth over $17 billion and climbing. But here's the problem. Depression rates aren't dropping. In fact, more people than ever are on medication. Yet hospital admissions for depression haven't gone down. If these drugs worked the way we've been told, why are so many still suffering? Today, we're asking the uncomfortable question: are antidepressants actually helping us heal or just keeping us quiet? According to the business research company, the global antidepressant market size is $17.41 billion in 2023 and predicted to grow to $25.52 billion in 2027 due to rising cases of mental disorders. Pharmaceutical companies have placed profit above the health of people, and in response to this, no one is holding the prescribing doctors accountable. This preoccupation with profit is also shown by the most popular antidepressants being marketed as the most expensive, but not better in quality than the cheaper antidepressants. The number 3 most popular drug was Cymbalta, an antidepressant that sold $5 billion a year worth of pills, even though it has never been shown to be superior to older antidepressants like Prozac, for which much cheaper generics are available. Bessel van der Kolk argues that if antidepressants worked, then antidepressant usage would have gone down, but instead antidepressant usage has increased. Consider the case of antidepressants. If they were indeed as effective as we have been led to believe, depression should by now have become a minor issue in our society. Instead, even as antidepressant use continues to increase, it has not made a dent in hospital admissions for depression. The number of people treated for depression has tripled over the past 2 decades, and 1 in 10 Americans now take antidepressants. Perhaps one reason hospital admissions for depression stay the same is because antidepressants do not work for all medicated individuals. Antidepressants are more effective, or perhaps only effective, in severe depression, and that this can explain their poor performance relative to placebo in trials with mixed populations. Not only do antidepressants have varying degrees to how they work, but they also do not work at all for some individuals. For reasons that have been unclear, SSRIs do not work for around 30% of people with major depression. Antidepressants do not deal with underlying issues. After conducting numerous studies of medications for PTSD, I have come to realize that psychiatric medications have a serious downside, as they may deflect attention from dealing with the underlying issues. The brain disease model takes control over people's fate out of their own hands and puts doctors and insurance companies in charge of fixing their problems. The antidepressants deflect attention from dealing with issues by oneself or with a therapist. Although the increase in mental disorders, example depression, generalized anxiety disorder, etc., stems from COVID and technology, the magnitude of antidepressant medication need sparks the question: are antidepressants being overprescribed? The antidepressant bottle's warning label includes potential physical and suicidal ideation repercussions. However, there exist other negative side effects of antidepressants that are being overlooked due to the pharmaceutical companies' lack of full transparency. This raises the question: what impact do pharmaceutical companies have on perpetuating trauma by not including individual and relational side effects of the medication on the warning label? How do uninformed mental health clinicians also contribute to the societal dilemma by not educating their clients on the full spectrum of antidepressant side effects? Antidepressants repress emotion, sadness, anger, and the highs of happiness. Peer-reviewed studies show that antidepressant meds interfere with the falling in love process, example through emotional blunting, and the depth of feeling in love, example through apathy. Dull instinctual self-preservation responses, fight, flight, freeze, and fawn, and speed up the agonizing getting over someone process. A 2009 paper published in the Journal of Affective Disorders found that the antidepressant Lexapro improved depressive, anxiety, and grief symptoms in individuals experiencing a major depressive episode related to the loss of a loved one. When antidepressants are given too early to someone experiencing heartbreak, grief, that person is not allowed to fully process the trauma because the antidepressant makes the grieving process shallow and short. 𝐾𝐿 concludes drugs cannot cure trauma. They can only dampen the expressions of a disturbed physiology, and they do not teach the lasting lessons of self-regulation. They can help to control feelings and behavior, but always at a price, because they work by blocking the chemical systems that regulate engagement, motivation, pain, and pleasure. Antidepressants essentially block out pain regulation, thus not allowing one to work through the pain. Antidepressants, if taken prematurely post-heartbreak, may repress trauma, and this trauma, lying subconsciously dormant, will eventually resurface once triggered and have an even greater negative impact on the healthy adjustment of the individual. 𝐾𝐿 proclaims that drugs like Xanax, Valium, and Librium are addictive and interfere with trauma processing. Most civilian doctors are reluctant to prescribe anti-anxiety drugs and minor tranquilizers because they have a high addiction potential and they may also interfere with trauma processing. Patients who stop taking them after prolonged use usually have withdrawal reactions that make them agitated and increase post-traumatic symptoms. Tolerance on the hypnotic effects of Xanax tends to develop rapidly. Dependence can develop as soon as 1 to 2 months in a patient who is taking a high dosage of a high-potency benzodiazepine agent such as alprazolam. Several guidelines for treatment of PTSD in adults, though not all, have recommended that trauma-focused psychotherapies be used as first-line treatments over any medication for PTSD. This is based primarily on the fact that in meta-analyses of PTSD treatments, the effect sizes for those psychotherapies compared to inactive treatments were substantially larger than the effect sizes for medications compared to placebos. All in all, antidepressants are addictive, and trauma-focused psychotherapies help target trauma more successfully than antidepressants. Therefore, if someone stays on antidepressants throughout many traumatic breakups and then gets off the medication, they could have a severe increase in post-traumatic symptoms. Many clients go on antidepressants as a quick fix to heartbreak, which ends up being a short-term fix because they inevitably carry this unprocessed trauma into other relationships and situations, as shown when their unresolved pain is eventually reactivated or repressed memories resurface. The meds, when given too early to a heartbroken client, not only elongate relationship trauma, but also perpetuate trauma. For example, a study showed that a wife who was being cheated on took antidepressants to tolerate her husband's promiscuity so she could stay in her marriage. However, if she was not on the medication and shrouded in misery over the infidelity, she would not be able to tolerate the pain, and her suffering would most likely drive her out of the abusive situation. Studies highlight antidepressants repress protective instincts, and in the wife's case, those instincts were fight or flight. Therapists and psychiatrists need to be holistically educated on the negative effects of antidepressants and encouraged to share this knowledge with clients. Clients in serious relationships or marriages are left unaware of antidepressants' impact on their romantic relationships because the warning label only refers to physical or suicidal side effects. In addition, psychiatrists, psychologists, and counselors do not always educate clients on antidepressants' emotional impact on individuals and future relationships. Previously changing the label caused a decreased willingness for non-specialists to prescribe antidepressants so readily. In 2004, the Food and Drug Administration released a black box warning label for all antidepressants, indicating an increased risk for suicidality in children and adolescents. The label was subsequently updated in 2007 to include those up to 24 years of age. Data have since emerged to indicate changes in clinical practice patterns of non-specialists, example, non-psychiatrists, prescribing medications. Among the changes reported in practice patterns are an increased likelihood of referral and a decreased willingness to prescribe antidepressants. Because this more conservative approach among non-specialists decreased willingness to prescribe antidepressants occurred after the modification of the label, then another wave of change would likely occur, and that non-specialists and specialists would become more careful about when to recommend antidepressants during the grieving process. Peer-reviewed studies will be presented as shown in the qualitative and quantitative cases below that investigate emotional blunting from antidepressants and the lack of a detailed side effect description on antidepressant pill bottle labels. Antidepressants are proven to cause emotional blunting, including apathy and numbed survival defense instincts. It is well established that in both men and women, these antidepressants can cause emotional blunting, weight gain, and several types of sexual dysfunction, interfering with sexual desire, sexual arousal, genital sensation, lubrication, erection, ejaculation, and orgasm. Thus, researchers propose that serotonin-enhancing antidepressants can have far more serious psychological, social, and genetic consequences, including mate choice, mate pursuit, feelings of romantic love, and expressions of attachment to a long-term partner. Antidepressants have been shown to potentially jeopardize the ability to fall in love and maintain a stable long-term partnership. If antidepressants can jeopardize the ability to fall in love and maintain a long-term partnership, they certainly can help someone more quickly wean off a partner after a breakup. Because emotional blunting causes a relational impact, there exists a patient-centered self-report measure of emotional symptoms present in patients treated with antidepressants. The Oxford Questionnaire on the Emotional Side Effects of Antidepressants, 𝐾𝐨𝐧'𝐭, was published in 2012 by the Oxford University Innovation. This report can be completed either on paper or online. The 𝐾𝐨𝐴 appears to be a highly acceptable, valid, and reliable measure with sensitivity to change. The 𝐾𝐨𝐴 offers promise as an effective self-report measure of the symptoms of emotional blunting in patients with depression. The creator's hypothesis is that it captures novel aspects of depressive mood, either residual symptoms that remain after successful treatment with antidepressants, or emotional side effects of antidepressant treatment. The 𝐾𝐨𝐴 can be used as a clinical tool to facilitate the identification of patients with the syndrome of emotional blunting. Once emotional blunting is formally detected in a client, then the therapist and psychiatrist, in conjunction with the client, can decide if staying on medication is right for them. Psychiatrists are prematurely prescribing antidepressants, defined as earlier than 6 months, for breakup, situational depression, or relational unhappiness, heartbreak, when, in fact, the patients are just in the grieving process. When individuals experience grief longer than 6 months, it can be called complicated grief, an adjustment disorder, prolonged grief, or situational depression. Grieving for 6 months has a positive psychological impact. In an uncomplicated grief process, painful experiences are intermingled with positive feelings, such as relief, joy, peace, and happiness that emerge after the loss of an important person. At least one investigator has found that positive feelings at 6 months following a loss are a sign of resilience and associated with good long-term outcomes. When clinicians prescribe antidepressants too early for grief, they end up dulling the budding inner resiliency of the person. According to The Atlantic, with the elimination of the old DSM's bereavement exclusion, In diagnoses of major depressive disorder, MDD, psychiatrists aren't advised to wait 2 months after a patient loses a loved one for the period of normal grief to pass to diagnose mental illness and prescribe antidepressants. By prescribing antidepressants prematurely, lingering breakup trauma can be shown through the manifestation of continued low self-concept. It is proven that unhealed trauma lowers self-concept. Self-concept also lowers after a breakup. People ask themselves after a breakup, who am I? Since identities molded together as one. Therefore, if breakup trauma is subdued or repressed by antidepressants, then self-concept will still be low once the person gets off antidepressants, compared to a person who heals from breakup trauma by going through the grieving process without prematurely prescribed medication. According to Lust, Romance, Attachment, do the side effects of serotonin-enhancing antidepressants jeopardize romantic love, marriage, and fertility? Approximately 80% of antidepressant drugs are prescribed by non-psychiatric physicians, including internists, general practitioners, pediatricians, and gynecologists who disseminate them to a wide array of men and women. These clinicians have more liberty with prescribing, partly in part because of the DSM-5's elimination of the bereavement exclusion for antidepressant intake. The natural cycle of grief can now be diagnosed as major depressive disorder from the beginning. As shown in the Washington Post, the American Psychiatric Association voted to drop the old warning against diagnosing depression in the bereaved, opening the way for more of them to be diagnosed with major depression and thus treated with antidepressants. The change in the handbook, which could have significant financial implications for the $10 billion US antidepressant market, was developed in large part by people affiliated with the pharmaceutical industry. An examination of financial disclosures shows. The association itself depends in part on industry funding, and the majority of experts on the committee that drafted the new diagnostic guideline have either received research grants from the drug companies, held stock in them, or served them as speakers or consultants. Perhaps the change in the DSM-5 was biased due to pharmaceutical financial gain. Additionally, pharmaceutical companies do not list the various relational side effects of the drug. In unconventional side effects of antidepressants, focus on emotional blunting, the study's results showed differences between the two genders. Women taking antidepressants had more sexual side effects than men, whereas men taking antidepressants complained a reduction of the feelings of love. If antidepressants affect the quality and depth of love and attachment between a couple, then they can cause an earlier detachment between the grieving medicated individual and past lover. The grieving individual does not have to go through the grieving cycle to reach detachment acceptance, but rather can avoid the cycle by artificially accelerating the process. In addition, the Washington Post recounts a study that found breakups not only altered self-concept, but that people who have a greater disruption in their self-image are also more likely to experience more post-breakup emotional distress. Antidepressants' emotional blunting causes someone to get over a breakup more quickly on the surface, but in doing so, this may keep someone's self-concept low after the breakup, especially for those who already struggled with self-concept.